7:53. Welcome back, everybody. Dr. Paul is here. How are you?
Very well yourself.
Good, good, good. We're going to talk flu shots. Just got an email the other day from headquarters because we have a flu clinic here every year. Some
Sure.
people get the flu shots, some don't. What do you recommend?
I recommend that you should seriously consider getting the flu shot, especially if you're at high risk for the flu and its complications.
And there are high-risk groups,
Yes,
right?
there are. There are the elderly, obviously, anybody of any age with chronic medical conditions or weakened immune systems, and children less than 5 years of age, actually.
Right.
6 months to, and specifically 6 months to 24 months. Those are quite sensitive, those kids.
Right.
And so every year we get the flu coming in. Flu season usually arrives January, February, March. And we start our flu shot season October, November, in order to build up immunity for people to protect themselves. And one of the fallacies that people sort of talk about the flu is, I don't want to get the flu shot because I'll get the flu. Well, that's not true. That's not true. It's a dead virus that's in there. The other thing that people say, why do I need to get it every year? I got my flu shot last year.
Yeah.
The problem is that the flu itself, the virus itself, there are several of them that are in the air type of thing, and they circulate, and every year they change. So last year's flu shot won't give you protection for this year's flu virus that we're predicting, and that's the problem.
What are you predicting this year? What kind of flu strain is out there?
There are usual ones that we're actually still protecting against H1N1, the A H1N1.
Right.
There's another A and there's another B. There's two different types that are in there. So we predict that, the World Health Organization predicts that, and usually they're kind of right on. The other thing that people say is, I got my flu shot, but an elderly individual said, well, I still got the flu. Yes, but because you got partial protection.
Right.
All right, and they did get the actual flu. It's not that the vaccine didn't work. It actually worked to do the job that it had to do. In other words, we don't want people to go to hospital, and we don't want people to die. So if you, because the elderly don't get a good immune response. If you inject the virus into them, the vaccine into them, their immune system won't be as strong, if you like.
Right.
But at least it will give them some protection that would be much better if they had not received the flu shot at all.
A lot of people do say that, as a matter of fact, and I've had recently a couple of colds myself. I'm not sure if it's flu related or if it's cold related or that sort of thing.
Well,
but there are a lot of fallacies out there about,
there are.
what the flu shot does and that sort of thing. Some people will get the flu shot for years and then they'll get sick and then they'll be like, I'm never getting the flu shot again.
The other thing that people have to realize is about 250 viruses that can cause the common cold. And the common cold
is not protected.
That's right. And the common cold is not the flu. The flu really is a virus that gets into your body, you inhale it, and it really can cause severe muscle pain, headache, fever, chills, much higher, much more serious and longer course than the cold itself.
Yeah.
The cold gives you a runny nose, a bit of cough, maybe low-grade fever, it goes away. You don't get those body aches. And if you've had the flu, you know you've had the flu because it puts you out for about a week or two.
Yeah, exactly. I mean, you can walk around and I know the latest cold that's going around or whatever it is seems to last a while with tickling throat and that sort of thing, and it's hard to get rid of. But the flu can be...
It can be quite dangerous and actually can cause severe respiratory problems. People get admitted to the intensive care unit, and actually people can die from the flu.
Yeah. Before we go, who do you check with to see if a flu shot is a good idea? Do you go to your doctor?
Well, you go to your doctor. I think a flu shot is a good idea for everybody. In the past, we had reasons not to give the flu shot. For example, if you had an allergic reaction to the flu shot itself before, or if you're egg allergic.
Yeah.
And that's changed. This year, for the first time, it's changed.
If you're egg allergic?
If you're egg allergic, speak to your doctor, but it doesn't mean you can't get the flu shot.
Yeah.
There are new techniques now and new approaches that we have.
Good stuff. Thanks, Dr.
Thank
Paul.
you.
I'll be lining up at the clinic here
Great,
at the
me too.
station. All right.